guys, Lauren here with Bizrok. In this week's video, I want to talk to you about the difference between front stage and backstage. So if you've ever done trading with us, you've heard us use these terms before, but I want to share this with you because it's so important to providing that exceptional experience for your patients. So let's start with backstage, shall we? So backstage is what our patients can't see or hear. Backstage might be the conversations that you have in private as you're preparing for your day. It might be your morning huddle time as you're going through the logistics of your patient flow and outstanding treatment or outstanding balances, all things that are great and important for running a successful business and having, a productive day. But all important conversations that our patients should not hear, okay? So backstage are the things that we don't want our patients to see. They're the things that we don't want them to overhear. So all of the examples that I just shared, outstanding treatment, balances, logistics for the day, who's seeing what patient, who's helping flip what room, all of those things we don't want our patients to hear or see. The other thing about backstage is it's our personal conversations. It's, going to tell your former or your fellow team member about your weekend plans. Guys, I love team bonding and team experience is so important. But backstage means that our patients shouldn't be hearing those things. And, having a one-on-one conversation with a fellow team member and sharing with them about your weekend plans, probably not a good conversation to have in front of your patients. Remember, it's not about us, it's about them. It's about us providing that exceptional experience. Now, if I'm your hygienist and I'm talking to my patient and hearing about their weekend plans and they ask what I'm doing that weekend, that's okay to share. But they shouldn't overall hear what you have going on. You want to make sure that those conversations stay private. So that's all backstage. Here's the other one that I'll share with you that sometimes gets forgotten. Front stage starts whenever you pull into the parking lot. See, sometimes we think backstage is outside of the practice. It's the parking lot. It's the conversation that we're having outside before we ever walk into the space. But have you ever been outside in the parking lot and a patient pulls in? Or you see a patient, walking to or from the car? Guys, backstage is what we don't want our patients to see. So that means once we pull into the parking lot of the practice, that is where front stage begins. That's where that transition happens. And so front stage is what we want our patients to see or hear. Front stage is also what our patients can physically see and hear. So it's making sure that we're having positive conversations. It's making sure that we're not breaking laws of HIPAA and OSHA, and we're not sharing treatment in front of other patients, right? And so front stage is the positive conversations that we have with patients, the positive experience. Now, I know that sometimes patients have bad experiences or maybe they misunderstand things and you're like, oh gosh, this wasn't my fault, Lauren, but how do I reel it back in? Well, you want to make sure that your front stage is a front stage appropriate conversation with your patient. And so if your other patients can overhear a conversation between you and a patient and maybe that patient's getting heated, it is okay to take them into a consult room or a treatment room or step back to an operatory where there's not patients around and just say, Susie, patient, I want to make sure that you're taken care of. Let's step back into this operatory because I want to hear more about what you have going on. Don't make it about other patients, just make it about them. I want to be focused on what you're telling me. So let's go into this treatment room or this consult room so we can have a private conversation. It is okay to guide your patient in that way, but what's most important is that we're always practicing front stage. So whenever you walk from the break room to the hallway or to the front office area or to the back office area and there's patients around, making sure that you're focused on, okay, I'm front stage ready. That means I have a smile on my face. I'm ready to greet my patients. I'm ready to, give them an amazing experience. Guys, I know that sometimes you have bad days. I've been there. I promise, I get it. But our patients deserve the best possible experience that they can have. I always remind team members, your patients have options and they keep choosing to come to us. So we owe it to them to provide the best possible experience. I want you to think for a moment, maybe you have a loved one who is in the hospital or has to go to an important doctor's appointment, okay? And I want you to imagine that you get there and they're really nervous. but that nurse gives them an attitude, is short with them, doesn't make eye contact with them, isn't even smiling, doesn't seem to be happy to be there, how upset would you be about the care that your loved one was receiving that day? You'd probably be really upset, and you'd be like, hey, can I have another nurse? So let's flip the script. Imagine you have a loved one who's really nervous about going into the doctor's office or to the hospital, and maybe they've got a big procedure, and the nurse is kind and gracious and welcomes your loved one, makes them feel comfortable, even though she's got a lot going on personally, but you never know about it. Guys, that is somebody who is displaying amazing front stage. See, our patients owe it. You want to treat our patients just like their family. They're the most important family or friend in your world. That's how every patient deserves to be treated. Like I said, they have options. Why do they continue to come to our practice? What makes us so unique and so special? Well, it's how we make them feel. You know, if you've done training with us in the past, we've probably shared with you, patients only remember about 6 to 10% of everything that we say. Guys, I don't know about you, but that's exhausting. So that means we spend 30 minutes educating a patient, and then they walk up front and they're like, what did she say I needed? Ever had that happen? But they remember 100% of how you make them feel. And it starts with how we make them feel at that front stage interaction, that very first interaction. So even if you have things going on in your personal life, here's what I'm going to inspire and ask you to do. Guys, do your very best to just check it out the door. Check it out the door. Check it in the break room and just say, you know what? I just need to get through this patient. This patient deserves the best experience possible, and I deserve to give it to them. So I'm going to give front stage. Front stage is a great attitude. It's smiling. It's making eye contact. Guys, here's the thing. All of those things are free to do. They're also really easy to do. It's also really easy not to do. For the team member that's watching this video, if you're looking to grow in your career and as an individual, and if you're like, gosh, you know, I want the opportunity to be impacted financially at some point, here's how you do it. You practice and master front stage. You become more valuable in your organization the more that you display a positive attitude, a great attitude, a willingness to help, a willingness to go above and beyond and make every single one of your patients feel special. Guys, that's the power of front stage. You increase your own value to your organization. So here's what I'm going to inspire you to do. The next patient that you see or the next day that you're in the office, practice front stage. Say, all right, I'm front stage ready. I'm ready to go. I'm ready to serve my patients. Leave backstage, check it out the door so that you can serve your patients to the very best of your ability. Guys, if you need help, if you need additional guidance, please reach out. We love what we do. We love helping and serving you. Otherwise, we look forward to seeing you and serving you soon.